Welcome to BioIT World's Trends from the Trenches podcast, your insider's look at the science, technology, and executive trends driving the life sciences. I'm Allison Proffitt, editor of BioIT World. This episode is hosted by Stan Gloss, founder of BioTeam, a life sciences IT consulting company at the intersection of science, data, and technology. Joining Stan today is Adama Ibrahim, VP of Digital Strategy and Change Management at Novo Nordisk. Together, they discuss humanity's natural resistance to change and how organizations can incentivize their teams to embrace change in an ever-evolving world. Let's listen in.
Good morning, Adama. How are you?
Hello. Great to be here. I'm doing super well. How are you?
Great. I'm been looking forward to this conversation for quite a while. And I'm intrigued by your title, and you'll tell us a little bit about it. But change is something that's in your title, which I've never had the opportunity to interview anybody with the word change in their title. So maybe with that, maybe you could tell us a little bit about you and the work that you do, and a little bit about the work Novo Nordisk does.
Yeah, absolutely. Pleasure to share more and describe, my journey to change, so to speak, and where that is heading while I'm part of whilst I'm part of Novo Nordisk. So I started my career, working in the NHS, and of course, being from a scientific background, from an education point of view, I have developed this natural curiosity, around what makes things work, and especially from the human body point of view. We talked about physiology specifically when we had our first intro. I'm genuinely curious about how the body functions as a machine, and that led me to clinical trials and research, and trying to understand a little bit deeper in terms of when the system is broken, how it's fixed. And that led me to clinical trials. So working in drug development for so long across 5 different pharma companies, and learning a lot along the way, working on multiple types of diseases and trials and settings, I discovered a passion for technology transformation. And in the past 5 years, I've started to work really heavily on innovation and bringing new things, to help us do what we do better, whether it's in development or now in research. And one thing that's been a common thread from the start of my career until now is that we live in a changing environment, whether it's in the body, whether it's in the areas and processes and people around us, or even the world at scale, with what's recently happened with the pandemic. So change is inevitable. And in order to stay curious and stay true to learning and growing, we have to embrace change. So I've started to, at the earlier parts of my career, started to really learn about, at the time we called it transformation. And I think that's a term that most people are familiar with. How do you move from one state to another to achieve business goals? Whereas change is actually much more, for me, philosophical and much more human and much more personal. And so right now, I'm working really, really closely on the human side of change and the way that influences our behaviors and either brings the best or the worst of that behavior. And that really, what's interesting is it is relating quite solidly and clearly in a measurable way to business outcomes. So my day-to-day currently at Novo Nordisk is research and early development, digital strategy and change management lead. So I'm heading up an organization that has a change management office to support the research organization as it transitions from, to keep it simple, manual activities to more digital focused activities. And really leveraging the power of AI, which we all, hear about, to build those insights and accelerate drug discovery, and most importantly, first in human doses. So we need to help scientists. We need to help everyone around the world of science, biology, chemistry, and so on, to learn how to come on this journey in a way that optimizes what we do well, which is that depth of scientific knowledge, but also then bring in what we don't do so well, and learn and grow in a very symbiotic way as we transition these worlds. And so, yes, we live in I'm keeping it simple again, these binary universes of scientific and digital, and they need to come together very, very fast. There are layers to this, of course, with business value realization and so on. But ultimately, when you think about it, we are in the business of humans. These are people. with lives and cultural backgrounds and educational desires and all sorts of pulls and pushes and strings, right? So in order to harness all of that together and optimize it in a way that makes sense for the company and what the company, and I'll come to Novo Nordisk's mission right now. If you look on our website, we are in the business of defeating serious chronic diseases. And we really have put that ambition quite high. That means that everybody, in the company has to do our very, very best that enables us to achieve this mission. It is a tough mission to do. If you look at obesity and diabetes, for example, it's some consider it as the pandemic itself, with the way it's rampant across the world. So to defeat it really needs us to work differently and work smarter, but work faster. So that's part of what I do, where I came from, just a bit of background and where we are at the moment with Novo Nordisk.
So I couldn't help but notice in the description that you just talked about the work and the way you think, many companies are still living in the second industrial revolution kind of approach where they think of their organization as a machine, and these are all cogs and all of that. So actually, when you think about change and change management from a machine structure, you really don't want machines to change all that much, as opposed to where we need to be in a fourth industrial revolution model, thinking about our organizations as living systems. And I just couldn't help but listen to the way you describe things, to hear the living systems approach, adaptability, growth, all the things we attribute to our bodies. Why shouldn't we attribute those same things to our organizations?
I agree. And I 100%. What's interesting here is that depending on who you speak to, so if you speak to engineers, they look at things very, like you said, mechanically, technically, measurable, binary into some degree. And if you speak to social scientists, they look at things in a fuzzier way, in a way that is a little bit more of that human side and using different parts of the brain and painting colors into things as opposed to definite, lines. So I agree for sure that the systems approach makes more sense to me. And I actually also agree that we need to consider organizations and people now as data points. We are data points. And each point, each data means something in that system. And in order for us to stay and maintain this homeostatic balance that is necessary for optimization and high performance, we need to make sure that we understand, what each piece does and how they work together. Again, the systems approach. So you and I are definitely on the same page where for a very, very long time, and part of the reason why we're very slow in adopting new technologies and modernizing our operating model, claiming that regulation is why we have to stay true to traditional ways of working. That's not true. We know that's not true because even the regulators are updating their ways of working, right? So we can do that too. But really, when you think about the crunch of it, is that we have not made those connections. We have stayed true to one side of the system, but ignored or have been blinded, by completely the other side, other parts that are also necessary to keep things whole and keep things complete and obviously high performing. So coming back to where and how we could evolve into this mindset and this thinking, again, goes back to data points, because if we don't have the evidence that supports this approach, then it becomes even more challenging to convince the traditional mindsets, which are very scientific, very evidence-driven, to say this is what is needed for this to be true, and this is also how things can look as you gradually shift, from one phase to the next, and you make those evolutionary types of changes.
So I've had many conversations with executives, especially in the pharmaceutical industry, where the word transformation is used all over the place. And when you say we're going to do something that's going to transform something, that sometimes is a very hard thing to even imagine something transforming. So the word that I hear used, really by people who understand change is the word progress. Ultimately, organizations want to take initiatives that make progress. And my feeling is that if you're making progress in something, you can measure progress. But whether or not something is transformative, that's harder to measure. So I think you're tying to the data points that you just talked about, that I can measure something progressing. I mean, something growing, something doing something different. From a scientific basis, there is a basis for measuring progress of something. What
Yes,
do you
I
think?
agree. I definitely agree. To some degree, we're also coming back to that human side. We're not leveraging our true nature as humans, and humans have expectations, and therefore, if we set out a transformation as a goal, that expectation is different depending on who you talk to. So if you don't actually define more accurately, maybe the term is not, as you said, not as clear and not even translatable, as it should be, right? Because it means so many things to different people. So
Right.
if we have better terms that are easier to accept, from a different cultural dimension and also different functional, role and categories of people that fit into one organization, it makes more sense and it's easier for people to understand where they fit in that transformation kind of paradigm. So I like your ideas of progress being then you go, what is the progress we're looking for? The measure 2x, 3x, is it, today and tomorrow? Like, what is it? And for me, it starts with, even before you get to that definition of the change, it starts with the expectations. So in terms of what are the expectations that we have for making that change, or what that change needs to deliver to, or what that change needs to look like. And for me, it's always a case of, and to keep it really simple, is it an incremental progress or is it a disruptive progress? And I speak purely in the innovation space. That's how we consider these types of progressive changes, right? So if you don't have that clearly defined and understood, and it all depends on where you are, your maturity level, your appetite level, your investments, risks, and all of those things that are part of what that expectation looks like, it is really, really, really hard for you to accurately define what progress is going to be realistic for your so-called transformation.
Yeah, and I love the kind of tie into incremental versus, really explosive growth. Kind of reminds me of our human body in evolution. We have things that are evolutionary, and then there are revolutionary things. There's, and those revolutionary moments, those 10x moments, those things in evolution are called punctuated equilibrium, where we punctuate something and then it now achieves yet another new plateau, and then we're now back to the steady progress up the hill. So it's interesting. Clay Christensen's work, they talk about 3 different types of innovations that align with this. So he talks about sustaining innovation, efficiency innovation, which are your slow, steady slope growth change. And then he talks about market creating innovation. And this market creating innovation is really it's addressing a part of the market that can't consume something. So if there is a complete blockage of something, a non-consumption area in your organization, that you can find those areas of non-consumption and now turn them into, consumption. I kind of use the metaphor of the data lakes that we all built and having thirsty scientists that can't drink the water. So how do we, when you can open up the pipes and,
Yes.
quench the thirst of the scientists in your
Yes.
organization, these ideas of having, could we have, I hear many pharmaceutical companies say they want to triple the number of drugs that they produce at 1/3 the cost. Well, that's pretty revolutionary, but how can you do that? So anyway, I just wanted to get your thought on that.
I am totally with you. So my immediate analogies, as you even described this concepts and proven ways of deductive thinking, from evolutionary to even innovation space and to where we are today and the challenges is when we consider the first in class and best in class, types of discoveries, drug discoveries and developments that we aim for. That's the same concept, really. Are we looking for disease modifiers, or are we looking for game changers, or are we even looking for curative with gene therapies? So we have to be, that expectation for me is so key. And really what we set out to do has to match reality, because it could well be, from a very scientific and very deductive perspective, the achievable goal is what it is. Until we have some new brainwave of either human scientific, breakthrough, or we have some AI breakthrough, because those two now come hand in hand. It is not possible to continue to think and believe this is achievable. But what I also find is that when we look back at history, it is such a good compass sometimes. It does give us some indication of what is possible. And yes, that is limited to our dreams and limitations as humans to not imagine the impossible often, but we need to stay grounded on what is possible, because typically, the idea of us being in pharma and us working with finite resources doesn't allow us to dream so big all the time. But we can still consider learnings from the past, and our ambitions and expectations, and really working in a way that enables innovation to thrive. I think those are the ingredients that, once they're in place, we will continue to have something that is a combination of maintenance and incremental, the new equilibrium that you described. I think those will be the shifts. And part of what I do currently in change management is working at those levels, because we have to create these ecosystems approach, or enterprise level change readiness, where we are individually sparking off each other, and collectively the big sparks creates the big bangs. And then we also at the project initiative, clinical trial, even whatever it is level, we're enabling those changes, the micro changes, to happen as quick as they can. So they create this wave of change that is smoother and less bumpier to allow the bigger changes to continue to happen. So it's almost symbiotic a little bit, where one change affects another change, and, obviously we kind of push through. And yes, it's a new way of working. It really is. It's a completely different muscle to pull, because it takes us out of the comfort zone slightly. You get comfortable with the discomfort, if that makes sense. So
100%. And I'm thinking about the book Atomic Habits. In that book, I've got the author's name right up, not coming to me this second, but they talk about the concept of really on almost on a daily basis, if you can make a 1% change and just do that 1% change, how do we make this process 1% better today? Over a period of a year, that compounds up to a 30% improvement in time, a series of small 1% changes. So I love the fact that you talked about thinking small to go big. So my fundamental question for you is, why is change so hard?
Oh boy. Okay. So it's quite a simple and a complex question at the same time. From a simplistic point of view, it's human nature. It really is. So, and people describe this when you look at the change management methodologies, the ProScience and ADCARS and all of the, certifiable schools of thought. You find that the consideration for the resistance to change, or the path to change, the journey to change, is exactly the same journey with coping with grief. When you have a bereavement or a loss, it's the same human psychological journey that's been proven. So that's why it's difficult, because humans naturally resist change. It's you almost go through a grieving process before you actually go through that cycle and you turn the corner from, anger, disbelief, rejection, avoidance, denial, and then you go to acceptance, and then you go to you're almost neutral, and then you actually start to embrace the change and adopt it, and then you actually start to evangelize it. So it is a complete cycle. And what's interesting is everyone goes through that cycle at different paces. Some get stuck at different parts of the cycle as well, and they need to be unstuck. And that's why the habits help. Some other interventions help. Lots and lots of things can depending on where you are, can unstick you out and keep you moving forward. So that's one of the, the simplest, most studied, proven, reason that we resist change. Or why change is so difficult. I think the other reason is actually thinking about people who create the change. So it's almost a double-edged sword where knowing that change is difficult, we're doing nothing to make it easier. And if anything, we're doing almost more to make it even more difficult. So that means, in simple terms, that whenever change is created, so let's say a new product is created, a new digital health solution is put on the market, a software is created for clinical trials, or a new automation solution is built for lab technicians to help them with pipetting. We have not considered the end user. We have not considered their journey when they are interacting with that software, whether it's a physical to digital interface or whatever it is that is part of the natural journey of the activity and the workflow. And we've kind of assumed that we know what their problems are, and we've assumed that we can solve them because we are the experts, of creating and building these technical complexities. And so not having that customer mindset and customer view and being able to fully be in line with the problem and the solution from the customer's point of view makes change a lot harder. So that's why I think it's difficult. And those combinations don't make it any easier.
So if we kind of think about frame change in the physics kind of framework, the organizations can provide a lot of force driving change in one direction. The question is do they actually take the time underneath the force of thrust and resistance? And if you think about how an airplane lifts off the ground being so heavy, it is a feat of thinking of the physics of power and thrust as a function of resistance and being able to do that. So do you see that in play in your organization?
Yeah, that's a really good question. So when we maybe use behavior change as the example here, it's a perfect analogy for an airplane lifting off the ground and the force fields, that are responsible to push, gravity obviously downwards and the upwards thrust that's going on. So with behavior change, and this is something we're seeing currently, by the way. So I brought in behavioral science as a capability in change management because I fully recognize those pushes and pulls. And the activity and so the action that needs to happen with change is a behavior change, because we are in the business of people and we're trying to influence people to behave in different ways, whether it's adopt a technology, stop using something, change something, that sort of thing. So in order to do that, you have to take the force against the change, which is the resistance, and the force that helps to drive people towards the change, which is other things, right? So what we started doing is using schools of thoughts that I can't remember this Turkish researcher's just name, but he did a lot of study on antecedents, behaviors, and consequences. So literally ABC of behavior change. And it's a bit like the 10 steps of alcoholism or drug abuse or whatever, right? So it's the same concept, where you have to have antecedents for any behavior change. And that really means what needs to be in place to enable the change. So, for example, if you feel hungry right now or you feel thirsty, you feel hungry because there is an absence of food. If we put food in your tummy, you're not hungry anymore, right? So you're not going to go and seek food. You're not going to go and cook food. You're not going to go and buy food. Nothing to do with solving hunger will happen to you right now. But everything to do with I'm full is because that's going on, because we've created that environment. And so the same with behavior change. If we create the environment that really drives people towards the behavior or away from a behavior, that's step one. And then the third step is the outcome of the behavior, which is, the adoption, the whatever that you obviously need to see, the measurable KPIs, that you need to see. And here we're approaching things in exactly the same way, because we have the same types of transitions that we're expecting resulting from good key behavioral indicators. And we're trying to put in place the right enablers to drive the behavior. And some of them, believe it or not, are not even what you think. They're not even the traditional, I suppose, approaches. So we're looking at culture to be one of our drivers. Because if you have the right culture, and we've noticed this in a lot of successful startups and, really big companies that are advancing and growing into, how many figures of revenues, right? Because of their success. The one thing that they have, along with obviously their IPs, is the right culture. People have the right mindsets. People have the right thinking that's driving their behavior. And even if things don't work, the culture holds it together. It keeps you going. And there's a lot of research that's shown, culture alone can differentiate the same type of companies in terms of performance by up to 30%. So there is something here that we can, leverage. So I'm trying to pull, data-driven or evidence-based. I'm trying to pull some of these levers to say, how do we really enable, those shifts to happen in a way that's helpful, but also in a way that's compatible with human behavior?
Yeah, and it's interesting when you talk about culture because it really, the leader and leadership, and I talk about leading and leadership top to bottom. It's not hierarchical. Their leadership can happen at every level of an organization and people leading it. You can think about the human body and different organs at certain times have to take the leadership role in the body to maintain homeostasis. But if you don't actively create the culture that you want, the culture that you won't want will evolve because every organization has a culture. There's no organization that has no culture.
Yes, I agree. I definitely agree. I think culture is definitely by design. It's not if you want to be successful. It is by design. You don't leave things to chance because it's also quite a multidimensional thing, right? You're not, most companies don't just have one culture. There is one leading culture, which is the overarching values and, what brought you here for however many years you've existed. In our case, what brought us here 100 years is what we call the Novo Nordisk way, which is a set of values that we have. Most companies have this. And this is something that has stayed true, over the past 100 years. And it's something that is incredibly powerful, actually, that people really recognize in the company and people live by. But it isn't unintentional or random, like you described. It's something that someone really thought about. And it's something that you have to work on constantly as well, to drive through, to reinforce, to get people to react to it, to course correct, sometimes even to update. But you're right, it's something you must work on.
Yeah, and it's interesting when you told me you have to create an environment for change. I just kind of thought, I was just thinking about back in the day when Napster was the big thing and everybody was basically stealing music. Steve Jobs came up and said, no, we're going to come up with we're going to make a better mouse box. And he competed against Napster and created a paid interface, but the interface solved so much of the resistance problem that people were willing to leave a free platform and move over to iTunes to a paid platform. And that's really he nailed the resistance to the change. And once you've really worked on that resistance piece, because I think many organizations fail to recognize the power of resistance in the change process. They think that, we can dictate change or we can, have initiatives du jour for change. And then it will just magically somehow happen. It doesn't really work that way, does it?
No, it doesn't. But you're calling things out that are, really part of the journey that defines, how you navigate a change process. Some of it, yes, I think anchors on resistance solidly, and that's a beautiful example of how that could be solved and prove success. There are other ways to also look at it, and one of the ways is you can win over people with honey, basically, and some of it is around trying to understand, what is it in a given process that is going to unlock, some of the potential barriers or perhaps maybe drive people in a more positive direction. And so people can consider it like incentivizations or something that is a step, even though it's considered as an effort, it's actually a necessary step. As a human, I go back to this again. That is necessary. And the examples I can give you is, I don't know in the US if you have something called HelloFresh, which is pre-made food. You know the concept. They give you
Yep.
the ingredients, they give you a recipe, they make it just difficult enough for you to do something, a little bit of an effort, and then you come up with a food. And that's a concept.
Mm-hmm.
And the same for this baking, companies that have tried to sell these pre-baked ingredients, and nobody bought it if you just have to put water. But as soon as you crack an egg, then it's cooking, then it's baking. So it's just thinking about, what is it that we need to create that gives people this delightful user experience that makes them feel
Mm-hmm.
that they are connecting, in a way that they have connected with the previous flow that you're trying to disrupt or you're trying to change.
Mm-hmm.
So how do we make the new way of doing it, the way that is preferred? And sometimes you go with taking away the burden and the hurdles and the frictions, and sometimes you insert frictions that are actually pleasurable, that are actually reinforcing this validation of me. So when I give examples of scientists pipetting in the labs, and we have robots that can do it better, is that really what the scientists want? Yes, they want more data that's clean and steady and complete and integrated with FAIR principles. But actually, is there something that they are going to miss if they stop pipetting? Because what made them what made them even come to work and do science as a degree and work in to achieve PhDs and discover all sorts of patents started with pipetting. So are we really, really looking to remove that and take that away from the core and essence of this type of dignified role? And I'm just keeping it, as an example, but we have to think about it. Or do we actually create a robot that isolates, 10 pipetting steps for the scientists so that they can actually keep, the piece that they like about the job and at the same time allow the robot to do what the robot needs to do? Or do we even create like fake pipetting? There's so many ways to look at it, right? That can still help us achieve what we need to achieve.
Yeah, and going back to the example of Steve Jobs, he got rid of the resistance, but he also created a vision of a better outcome, which was 1,000 songs in your pocket, I think was for the iPod, walking around, because everybody used to carry these like notebooks full of discs, and that was kind of a hassle, and there has to be a better way. And when people lock into the combination of a better way and a more convenient way and something that they like paired with the reduction in resistance, that's really when you get that exponential growth, is when you can, if you connect those two things, you can really get there. Well, listen, this has been a wonderful conversation of change. We didn't even really talk too much about science, but change, I think it's really important. And that's kind of why I was so excited to talk to you today about, and I was hoping that we would talk a little bit about change, but we talked a lot about change. So any last pieces of advice for anybody listening about change and anything you could share with us?
I'm such an advocate of constant change and wanting to have more change in our worlds, because we are living in this really evolving and fastly advancing new world, with AI coming in. I keep, going back to this. And from all levels, whether it's young people to people leading companies, people who are retiring, everyone in this world is going to start interacting with a lot more advancements. So preparing for that really involves getting ready, and anything you can find that is going to help you manage the change journey that you're on personally will only accelerate this. And the more that we accelerate our adoption of this new world and this evolving world, I think the better it will be for everyone. So that's my last message. I'm on a journey myself, and I think it's one of those situations that we will never stop learning. So I wish you all very well, and I'm super grateful for being on this podcast.
And thank you so much. I really appreciated our conversation. Take care.
Thank you for listening to BioIT World's Trends from the Trenches podcast.